lot?
Me?
And you said, that's not me.
No, I wasn't. That's farming. That's so loud.
That's what you said in the surgery.
We didn't. Yeah, farmer's a loud talker. How's it feeling?
Great.
Not doing too bad?
No, I'm very pleased.
Lovely nails.
Thank you, sir.
No major surprises, hurt like hell for a day or two, and then slowly getting better.
Yeah.
That's better. Good. Working with therapy still?
Yes.
Okay. So therapy-wise, we kind of stay out of it. You and the therapist decide how much, how often, how long, just because everyone bounces back differently. So whenever you guys decide, hey, we're done, you look good, be done with it.
Okay.
I'll walk you through your pictures. Knee's kind of a mess on the inside, but let's not tell the knee because it's doing really well.
Yes.
And then basically, there are no restrictions on you. So as you feel to doing things, try to do them. It's going to tell you if it's too much too soon, and it'll get a little sore, a little achy. So ice is still your best friend. But he didn't do anything that you could cause any damage or harm to you by trying to do things.
Okay.
All right? Don't fall down a flight of stairs or anything. That would end badly for you.
Fine.
Usually you have 2 different socks on.
Yeah.
Okay, I'm just wondering. Me too. I'm just kidding.
That's my daughter, Rihanna.
I figured as much. I hate to coach your mom. I'm horrible. I'm sorry.
No, you're good. You were really
Have some
good.
fun.
Because I said yesterday to the therapist, I was like, I'm going to meet Eisenberg tomorrow.
Yeah.
He was like, yeah, we still talk, not like farmer. I was
No,
like,
yeah. People always ask me, like, I just like to come in. It's like fitting in like a family dinner, like the brother nobody wants. All right, so I digress. This is you. This is your insides. This is what he sees at the time of surgery. Okay.
Okay.
So when he's doing a knee scope, 3 main areas he works in. He works on the inner side of the medial side,
Yes.
outside of the lateral side, and underneath your kneecap. Okay.
Okay.
So first thing he's going to look at right here. This is the undersurface of your kneecap. And that looks pretty good. Nice, smooth, healthy looking white cartilage. You don't see any big flecks or anything hanging down.
Okay.
And then he's gonna come to the inner side of that medial side. And this is where, let's hope that the knee doesn't realize how bad it is. Let me start on the other side. I'll come back to it.
Okay.
So this is the outside of the lateral joint.
Ooh, that's pretty.
And you can kind of see it just looks pristine.
It does.
Nice, smooth, pillowy cartilage. This is the meniscus here in the middle. Honestly, couldn't look any better.
Okay.
Tale of 2 knees though. On the inner side, of the medial side, you had really damaged the joint surface to the point where you really have extensive cartilage damage on the end of the bone there. You can kind of see the difference. That pink showing through is some exposed bone. So this is really what arthritis looks like on a knee scope.
Okay.
The good news for you that's going to be protective, this is your meniscus.
Mm-hmm.
But there really was not any tears in the meniscus, so he didn't have to take any meniscus out.
Wow.
So anything he saw in the MRI was just from all these flecks hanging down off the end of the bone here.
So the fall that I had did joint damage?
It did. It's hard to say, is this new damage? It's so diffuse. This is probably was brewing, and when you fell, it just really, the proverbial straw that broke the camel's back, if you will.
Okay.
But the meniscus was good, and that's going to become important for you because you're going to need that cushioning because you have lost some of the cartilage on the end of the bone there. Okay.
That's insane.
It is. It's wild. I mean, he was floored when he got in there. Needless to say, so what he's going to do is, let me get pictures of it.
Now, how does one lose cartilage on the inside of the tibia?
Well, it's the end of the femur,
Oh,
so it's right
sorry.
here. That's okay. That's all right. You don't know.
I was downstairs.
That's okay. Most of the time, this is degenerative arthritis, meaning arthritis by nature is the wearing away of the cartilage on the end of the bone. We don't understand it completely. They haven't figured out what triggers this in some folks.
Okay.
So this was probably brewing, and then when you fell, it just set off this inflammatory reaction that got you worse.
Would that be osteoarthritis?
Correct.
Okay.
So after he gets in there with a shaver and starts kind of smoothing and trimming a lot of the stuff down, now you can kind of make sense of it. So this is the end of the bone here. Compared to here, you can see the distinct difference.
Yes.
Got rid of most of those loose fragments. You do have some exposed bone there. But again, big healthy meniscus in the middle, so that's going to prove important for you going down the road. This is the top of your femur right here. It's your kneecap on top, femur down here. Again, looks fantastic. So what he did is he did something called a microfracture. And that's these holes that he punches in the bone here. Okay?
In the femur?
Correct. So what that does, you cannot regrow cartilage. Okay?
Mm-hmm.
But this is kind of the old school way. What they would do is they would punch a couple holes and get this blood and the primordial ooze to seep out and create some scar to form in those patches to try to take the place of the cartilage a little bit. Okay?
Okay.
Truth is, you're doing really well. You feel good. That's a
Mhm.
great sign. In my experience, the folks that come in today, they're still really sore, really achy with a knee like this, are the folks that have a long road ahead of them. The ones that come in and say, hey, you know what, I'm feeling pretty good. I'm doing well. I feel better than before the surgery.
Mhm.
That bodes very well for your future. Okay?
Okay.
But realization is, this knee, you got an arthritic knee. He cleaned it up the best he could. You very well probably are going to need some treatment down the road. Okay? And ultimately, you're probably going to need a knee replacement at some point in your life.
Treatment as in?
Different injections, either whether it be cortisone or lubricants, things like that. And you may not. We'll see how you do. But we got to keep you active, keep you moving. So finish up with therapy. You're doing awesome today. So don't let this get into your head. These
Yeah.
are just pictures on paper. Understand that, okay?
Okay.
We treat symptoms, and right now your symptoms, you're doing great. So go with it. Increase your activity. We'll check on you in a month if you need us. If you're doing great, you're going to tell us, hey, I feel really good. I'll call you when I need you.
Okay.
All right?
What are the, sorry.
You okay?
Is there flight restrictions?
No.
Okay.
No.
I didn't know that.
Yeah, the risk of blood clots is really low with the knee scope. Anyways, you're already a couple of weeks out, so I wouldn't worry too much.
So he cleaned up arthritis pretty much.
Correct. Cleaned up all these loose fragments of cartilage that were kind of hanging off the bone. You can see you kind of start, and there's these big chunks of
What
flaps
is
here.
that? What causes it? It wouldn't bend and straighten out right?
Yeah,
Is that
because
why?
you had these big flaps that were kind of bouncing down a little bit. And it swells and it causes pain, so it hurts, so you can't move it. I'll shave
Okay.
most of that down.
Everybody was sure it was someone else's.
Yeah, and this is a metal probe, so he's kind of pulling and feeling to see if there's any holes he's missing, but meniscus was in good shape.
That's funny.
Yeah.
But not funny. Do you know any studies on collagen?
Not so much on collagen. They're playing with stem cell stuff right now.
Okay.
There's a Dr. Gardner in town that does most of it. Farmers looked at it. There's just no good data behind it yet. And some of the docs will do it because it's incredibly lucrative for a physician because it's all cash. The farmer, his moral stay won't let him even offer it to a patient if he can't prove there's any scientific research behind it.
Okay.
So it's developing. How old are you?
52.
Yeah, so I mean, in the next 20 years, things are going to change drastically if we can make it that long.
Looking at what we see and judging by how I'm feeling great,
Mhm.
do we have any ETA on years?
No.
Or
None
year out?
whatsoever. It could be 6 months, it could be 20 years. In all honesty,
Okay.
it's hard to say. I can only speak from my personal experience, seeing how well you're feeling today, how quickly you bounce back. That puts you in the very positive category, though.
Okay. And I was reading up, I don't know how you feel about this. Not that I was reading, but
That's okay.
studies are saying stay off of concrete, like walking isn't the best exercise.
Well, walking's fantastic. Running is going to be horrible.
Okay, don't do
The
that.
concern with walking on hard surfaces, if you don't have the right shoes on, you're putting a lot of pressure into the knee joint. But with that being said, if you go onto the grass, it's Florida, grass is uneven here, which is worse, walking on an uneven surface and kind of torquing the knee or just, steady walk. Running, like impact running, is the absolute worst thing you can do for a bad knee. But no, get out and move because the weight is paramount too. Any little bit, every pound you carry is 3 pounds through the knee joint, so it all triples.
Okay.
So that becomes real big. But no, get out, stay active, keep the quads nice and strong. That helps stabilize the knee and protect the knee too.
Do you prefer a stationary bike over walking, or?
Whatever the truth is, what are you going to do? You can go buy this nice fancy stationary bike.
Well, I have one at home.
Do you use it?
Yes.
Good. Keep going. I'm a big cyclist. I love cycling, spin, things of that nature. It's a great workout, but I also like being outside too.
Okay.
So just get out and walk. You don't have to be power walking. Sometimes just, distance walking just to get your body moving a little bit makes a big difference.
So the movement is more important than
You got it.
concrete.
But don't run.
No, I'm I have a chihuahua, so.
Yeah, no, they don't run.
Well, I have lost 23 pounds, so.
Think about that's
I'm
awesome.
still going.
Good for you. That's 69 pounds worth of weight through the knee.
That's crazy.
Think of it that way. I get patients,
Wow.
and farmers real blunt on weight. I cover my own, but we all know we need to lose some weight, but you got to get baby steps. You've lost a lot of weight. That's fantastic. But we have patients like, oh, I only lost 5 pounds. I'm like, that's fine. Go carry a 5-pound bag of sugar around. Tell me you didn't lose a lot of weight.
Yeah.
For you, go carry 4 5-pound bags of sugar around all day and tell me you didn't lose a ton of weight.
That's a
So
lot.
you're a rock star. Keep it going. Go with it, work on it. You look great today. So finish up with therapy. We'll see you back in 4 weeks. You can shower, you can swim, just don't get in the ocean. What? Yeah, about another week you can get in the ocean if you wanted to. There's nothing about it.
Okay.
But yeah, pools and showers are okay at this point. And then we'll see you in a month if you need us.
Okay.
Sound good?
Sounds great.
Questions at all?
I don't think so. I guess in the future, if I have any pain, do I go to the primary or just come back to you guys?
Unless you need a referral, you just come straight to us.
Okay.
So every insurance is different, but for the next few months, you'll be coming to us anyways. If you need anything. My hope is you do great and we don't see you for a couple of years.
Yay, team.
All right, my dear.
Thank you.
Have a good morning otherwise, Dad.
Am I able to go?
You're all good.
Okay.